The 47 member states of the World Health Organization's African region have given Dr Matshidiso Moeti another second 5-year term as Regional Director for Africa. The nomination took place on Tuesday at the 69th session of the WHO Regional Committee for Africa. This is the governing mechanism involving health ministers from all member states. So Dr Moeti joins us now via Skype to talk about her tenure and various health challenges facing Africa. Very good evening to you, Dr Moeti. Thank you so much for joining us.
Good evening to you and your listeners.
So congratulations on your re-nomination and your second term. Just looking at your last term, you said you saw the work to transform the WHO Secretariat as a priority, and you were able to better, especially the response to health needs of millions of Africans. Do you believe you've achieved that?
First of all, I feel very pleased and honored to have been re-elected to continue in our quest with my colleagues in WHO in Africa to improve the lives of Africans. I implemented, as soon as I was appointed, a transformation agenda to make WHO, as the Secretariat of our member states, much more effective at helping them to address their big challenges, their priorities for health. I do think we've made some progress in this. We've certainly improved several ways in which we work as a Secretariat, our work on outbreaks and emergencies. You'll recall when I was appointed was at the peak of the Ebola outbreak in West Africa in 3 countries there. So I think there we've done a very good job of improving our ability to help countries, and we've got data that shows that these days the time it takes for us to help, for example, a country control an outbreak has gone from over 400 days to about 51. That's just one example.
So, well, let's get straight into that. When you elected in 2015, as you said, was just at the onset of the West African Ebola outbreak. What did you learn about that outbreak at the time?
We learned many things. First of all, it was one of the few times we've seen an outbreak spread to urban areas, where the context in terms of people being in contact with each other, the risk of transmission is so much higher. So we've learned to be speedy and adjust our response and the government's response to that very complicated context of close interaction among human beings. One of the biggest lessons that we learned is about addressing the knowledge, sometimes the misinformation, the beliefs of communities. So we invested a lot in that outbreak in social research to know exactly what people were thinking, believing, and then to adjust our response and our messaging and our communication with them so that they could, first of all, trust the messages and they could change some very deep-rooted behaviors which are at the center of transmission. For example, when somebody is ill in your family, you don't avoid contact with them. And as Africans, the way we manage burial of our dead when we've lost family members is really respecting them, showing our love. So to ask them to make some of the adjustments to avoid being contaminated was very difficult for people. But we did manage it in that context. For me, those were some of the big lessons that we are now applying in the support we are giving in the outbreak that's going on, for example, in the DRC today.
Which is what I wanted to ask you, because surely that there is something different now with the outbreak in the DRC, given that it's the worst outbreak Africa's ever seen. So what lessons are you applying that you've learned from them that are now arising from also this outbreak in the DRC?
Yes. The DRC outbreak is happening in a very complicated context. So if you can contrast it with West Africa. West Africa was starting in very remote rural areas, quickly spreading to urban areas where there was population movement across the borders of these 3 countries. In the DRC, we're essentially supporting a government to do this work in a conflict zone. In a conflict zone and a very protracted political, social, and insecurity context. It's also a very heavily populated corner of the continent, of the DRC, and it borders on other countries that are also relatively heavily populated for their small size, Rwanda, Burundi, and there is intense population movement across borders in these countries. For example, from the city of Goma to Rwanda, you have 60,000 or so people crossing every day. That's unprecedented. The outbreak also happened, it coincided with an election, and so we had not only the security concerns but also political differences. It's in an area of what was then the opposition, so political messaging got involved in some level of misinformation of the community. So the response has been beset by problems of mistrust from the population and insecurity attacks. We've recorded over 200 attacks to responders to this outbreak, variously to WHO, other partners, local health workers, and even families who are cooperating with the response. So it's an extremely complicated situation that we are dealing with now.